Your doctor has recommended that you have a total mastectomy. But what does that actually mean? Total mastectomy is the removal of the breast. In most cases, mastectomy is required in order to remove cancerous tissue from the body. The extent of the tissue removed is determined by the amount of cancer present in your body. A total mastectomy involves the removal of the breast, but not the removal of lymph nodes or chest muscle that lies underneath the breasts. Your doctor has recommended that you undergo a total mastectomy because the cancer in your breast has progressed to the point that it is in danger of spreading into other parts of your body. And the only way to make sure that all of the disease has been eliminated is to remove the entire breast. This is major surgery, and the procedure will permanently change the outward shape and appearance of your chest. So make sure that you ask your doctor to carefully explain the reasons behind this recommendation. In the case of mastectomy as a treatment for cancer, the only real alternatives to surgery are radiation therapy and chemotherapy. But because breast cancer is so potentially dangerous, most patients who undergo mastectomy also receive radiation therapy, chemotherapy, or both. In any case, your doctor has recommended this procedure because he or she believes that surgery is in your best interest and may even be vital to your survival. Choosing not to have the surgery could put your health and life at grave risk. You must make sure to talk to your doctor about all of your concerns before making a decision. But as with all cancer treatments, a decision to act should be made as soon as possible. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. In the operating room, the anesthesiologist will begin to administer anesthesia, most probably general anesthesia by injection and inhalation mask. The surgeon will then apply an antiseptic solution to the skin and place a sterile drape around the operative site. Two incisions will be made, beginning at the middle of the chest, one along the top and one along the bottom of the breast, coming together just under the arm. The skin is then lifted up and away, revealing the tissue underneath. Beginning at the clavicle, or collarbone, the surgeon then begins to carefully cut the breast tissue away from the muscles that lie just beneath. When the breast has been completely freed, it is lifted away, exposing the top layer of muscle called the pectoralis major. If the cancer has spread to this muscle, your doctor may elect to remove it as well. When the surgical team is satisfied that they have done all that they can do to remove the cancer, they will release the muscles and other tissue. One or more drainage tubes will be temporarily inserted at the site while the healing process begins. They will then close the incision. Finally, a sterile bandage is applied. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. Following surgery, you should expect to feel soreness in your chest area. But the most profound after effect of a mastectomy is often not physical, but psychological. Adjusting to such a dramatic change to the shape of your body may be difficult. You should expect to experience a wide range of emotions, and certainly your doctor will probably encourage you to share your feelings with a qualified therapist, someone who can help you through this transition. The surgery itself only rarely leads to complications. One potential complication is a persistent residual neuralgia, or pain around the scar. It can be either localized or general. It may develop soon after surgery or even weeks or months later. A more serious complication comes from accidental damage to the nerves in the chest cavity.